I can see you have been talking so much on genotype, especially for those parents who are or couples who are intending to get married. Now let's focus now on the problem for those who have already gotten married who have had children with sickle cell disease or sickle cell anemia. Some of them feel guilty and they feel blamed. What about this should parents understand?
It's actually a very difficult situation because sometimes it's not the parents' fault. It could be that they never had any genotype test before they had the baby or got pregnant and had the baby. It could be that they had a genotype test, but the test result was wrong. We've seen cases whereby people run this test and they get a result, but on the long run, it was a wrong result, false negative result. But then there are some who know about this sickle cell thing, but they go ahead with this 25% option. Some are faith motivated. They feel they have faith and they feel it cannot happen. So we cannot really blame these people for what has happened. This has happened and it has happened, and there's a child in the picture who currently has sickle cell. So the best we can do is to not throw blame on them at that point in time, is to see how we can help the children and support them generally.
Interesting. Thank you. So you mentioned things about sickle cell crisis in one of your videos. What exactly happened in sickle cell crisis?
So what happened in sickle cell generally? So in sickle cell, we have different blood components. We have red blood cell, the white blood cell, and the platelet. In sickle cell, the problem is with the red blood cell. So normal bloods of other individuals or every other person has a particular shape that is quite flexible and is able to navigate the hollow tubes of the blood vessels. But the sickle cell patient, their red blood cell has an abnormal shape. It's not flexible, it's quite rigid and has pickled end. What I mean is pickled end, a sharp end. So this makes it very difficult to navigate the hollow tubes of the blood vessels, the walls of the blood vessels. And while they're trying to navigate the walls of the blood vessels, they tend to break down and sometimes they cling to the walls of the blood vessels and cause problems.
Wow. There's a problem about navigation and flow.
Exactly.
So the crisis, which of them? I know there are certain various kinds of crisis, sickle cell crisis. Which of them are the commonest?
Thank you very much for the question. So we have different crises, sickle cell crisis. We have the bone pain crisis, which happens to be the commonest crisis. And sometimes they present very early with this crisis. You can see a baby who has never been tested before suddenly present to the hospital and they're just crying. There's persistent cry, and you really think or do not know what is going on. Sometimes you might be thinking it might be sepsis, infection, meningitis, and you've started treatment, you've done all the tests, and it has come back and it is fine. And it could just be that the child is having bone pain crisis. In bone pain crisis, their bones, every part of their body is paining them, most especially their long bones are paining them. They are in severe pain and they have to cry. Another form of crisis, especially for the young ones, is dactylitis. They call it hand and foot syndrome. So if you have a child and suddenly their hands suddenly get swollen, their legs get swollen, and it's painful as well, and they cry, it could be that they are sickle cell anemic patient or sickle cell disease patient. The child is abnormally pale. You have a child, their palms are white, they're abnormally white. This child is pale. So it could be that they're having the crisis whereby their blood level is very low. So another form of crisis could be the acute chest syndrome. When you have a child that's having severe chest pain, finding it difficult to breathe, and just generally unwell, it could be that they're having acute chest syndrome. And there's another form of crisis called the sequestration crisis. In this crisis, there's a large pool of blood. The massive blood that usually flows around the human body gets pulled into the spleen, and suddenly their tummy gets very big. It is called sequestration crisis. It's another form of crisis that they can have.
So we are right to say that some of these are already some of the warning signs that parents should be aware of, or are there warning signs that parents should keep
Yeah,
note?
if you have a child and you don't know the child has got sickle cell and the child is having body pains, abnormally pale, hands and foot is suddenly swollen or suddenly enlarged tummy, you can suspect that your child is having sickle cell. But warning signs if you already know your child has sickle cell, there are things that you have to be aware of, things you need to know, just so that the child is properly managed, this child is properly taken care of. If you notice that your child is having temperatures, this is not the temperatures you have to start sorting out at home. You have to take the child to the hospital. If you notice that your child is abnormally pale, just white all over, yes, you need to take the child to the hospital. And generally, when your child is unwell, having chest pain, finding it difficult to breathe, or having bone pain, take them to the hospital to be looked at and properly managed.
Thank you. Very informative. Are there things that parents can do at home, or must everything be managed in the hospital? Are there any things parents could do in the
Yeah, thank you
house?
very much for the question. As parents, this is where we come in to help our children as much as possible. There are some things we can do to help prevent this crisis that we're talking about.
Mm-hmm.
One, you can try as much as possible to keep your child warm as much as possible, because cold temperatures or extremes of temperatures can trigger off a crisis. Another thing you can do is to ensure that they are drinking the water that has been prescribed for them. There's an amount of water that they have to drink. Usually we calculate this with their body weight, and your doctor will tell you this is the amount of water they should drink per day.
Mm,
Ensure that your child is drinking this amount of water.
mm,
And then another thing you can do as a parent is to make sure they have their regular medications. There are some regular medications that sickle cell children should be on a daily basis: the
mm.
folic acid, the vitamin C, antibiotics prophylaxis, anti-sickling agents, anti-malaria prophylaxis, quite a number of them. You have to ensure that your child is taking these medications. Another thing you can do is to help prevent infection as much as possible by observing adequate and good hand hygiene and general hygiene. And if you know your child or someone around is already unwell, do not allow your child to be close to them.
It sounds like there is so much stress that these children can encounter, children with sickle cell disease. Can these children live a normal life?
Yes, they can live a normal life, but as parents, like I have said, if you can do all the things I have advised as much as possible, they can live relatively normal life. If you're able to give them the fluid, give them medication, just do all the things we have just mentioned, they should be able to live normal life as much as possible.
Yeah, there are some parents that may not be fully aware of what to do. Are there certain things that parents should avoid? What common mistakes do parents make that may worsen crisis? Oh,
Thank you very much for that question. So, some of the mistakes that parents commonly make when it comes to managing their children with sickle cell: treating fevers at home. Child is having temperatures, but they're at home trying to manage this fever, manage the temperature. Also, they get so busy that they don't ensure their children are drinking as much water as possible. They get so busy that they forget to give their children the regular medications that have been prescribed. They may not pay attention, or they may be paying attention, but sometimes they probably forget, and they are unable to keep their children warm as much as possible. So these are the common mistakes that parents make when it comes to children with sickle cell.
thank you. Parents, you've heard that. Again, I want to ask, what routine clinics, how important is it? Follow-up clinics for these children.
Yes, it's very important because there are complications associated with sickle cell, quite a number of complications. So, if your doctor is seeing you regularly in clinic, he or she will be able to follow and be able to pick up any complications
Hmm,
as fast as possible. Also, some of the medications for children are weight calculated. So, from in every clinic, your doctor is certainly going to review your medication to see if they need to increase your doses or increase the number of times you're taking it based on your weight or based on the symptoms you're having or the child is having.
so that's important. Thank you. So, in all, what advice or message do you have for parents who have children with sickle cell disease or sickle cell anemia?
Thank you very much, my darling husband, for the question. So, parents, there's no need to blame yourself.
Mm,
There's no need to quarrel between spouses, do not need to quarrel among themselves. They do not need to throw all the blame. It has happened. The earlier you come to terms with it and try to sort things out and try to help your children as much as possible, the better. So my advice generally is that If you have the first child that's already sickle cell, try as much as possible not to have more children with sickle cell. Two, ensure that all the advice I've given to you today, you follow them, ensuring that your child stays well and hydrated. Thank you very much for listening to me and have a nice day. Don't
Thank you.
stop following Top Child Health with the Q Merita. Like, comment, share. Bye.